Here is a detailed overview of lung cancer, focusing on its pathophysiology, step-by-step, treatment, and prevention. Lung cancer pathophysiology, step-by-step process. 1. Exposure to carcinogens. Inhalation of harmful substances, e.g. tobacco smoke, asbestos, radon, air pollutants, introduces mutagens into the lung epithelium. 2. DNA damage and genetic mutations. These carcinogens cause mutations in key regulatory genes, such as oncogenes, e.g. KRAS, EGFR, become overactive. Tumor suppressor genes, e.g. TP53RB1, become inactivated. 3. Cellular dysplasia. Mutated cells begin to grow abnormally, losing normal architecture and progressing from metaplasia, dysplasia, carcinoma in situ. 4. Uncontrolled cell proliferation. Mutated cells evade apoptosis and immune surveillance, leading to uncontrolled division and formation of a tumor mass. 5. Angiogenesis. Tumor cells release growth factors, e.g. GEF, that stimulate the formation of new blood vessels to supply nutrients to the tumor. 6. Invasion. Cancer cells breach the basement membrane, invading surrounding lung tissue and possibly the pleura and chest wall. 7. Metastasis. Cancer cells enter blood or lymphatic vessels, spreading to distant sites like brain, liver, bones, and adrenal glands. Treatment options for lung cancer. Treatment depends on the type, NSCLC versus SCLC, stage, and patient condition. 1. Surgery, best for early stage NSCLC, stage 1 or 2. Types, lobectomy, pneumonectomy, wedge resection. 2. Radiation therapy. External beam radiation or stereotactic body radiotherapy, SBRT, used when surgery isn't possible or as an adjuvant. 3. Chemotherapy, often used for SCLC and advanced NSCLC. Common drugs, cisplatin, carboplatin, paclitaxel. 4. Targeted therapy, for tumors with specific genetic mutations, EGFR inhibitors, e.g. erlotinib, osimertinib, ALK inhibitors, e.g. crizotinib. 5. Immunotherapy, checkpoint inhibitors like PD-1, PD-L1 inhibitors, e.g. pembrolizumab, nivolumab, useful for advanced metastatic NSCLC. 6. Palliative care, focuses on symptom relief and quality of life for advanced cases. Prevention of lung cancer. 1. Avoid tobacco exposure. No smoking, active or passive, tobacco cessation programs, and public awareness. 2. Reduce occupational and environmental risks. Minimize exposure to asbestos, radon, arsenic, and industrial pollutants. 3. Healthy lifestyle. Diet rich in antioxidants, regular exercise, avoid excessive alcohol and processed foods. 4. Air quality control. Use of air purifiers. Stay indoors during heavy pollution. 5. Screening in high-risk groups. Low-dose CT scans for adults 50 to 80 years with heavy smoking history, per guidelines. 6. Vaccination and health monitoring. Though no vaccine for lung cancer exists, staying updated on vaccinations, e.g. flu, pneumonia, protects lungs and boosts immunity. Thank you. Have a nice day.